So if we go to Asia Pacific, again, this is an area outside of certain select countries that hasn't done a lot early in this decade, but they've been accelerating their goals of protecting the medicine supply as well. So if we look at Indonesia, Indonesia organized and finally passed a final law in December of last year. It's fairly comprehensive. I'll say it's fairly well thought out. It adds complexity. There are multiple different ways that companies can encode the information onto medicines. When you read the regulation, it talks about these things called identification products and authentication products or medicines. It's basically different classes of medicines. It's really important to understand if your medicines fit those categories because the coding and regulatory requirements are quite different associated with that. So I just put some details down on it. I can't tell you what the deadline is for these, for your own individual medicines. Why? Because it's actually based on what the dates are of the registration of your medicines and when you've registered those medicines in an electronic system. And then there's this clock that starts ticking from that standpoint. So what many companies have had to do is they've had to look at the product portfolio for Indonesia. They've had to chart what's the registration status and then say, when do we think that we're going to be ready and need to have to start reporting for Indonesia. Then if I go a little bit south and a little bit west over to Malaysia, another country that has been working and organizing. These are not final laws and final regulations, but the ministry anticipates to finalize them. And they've been working very diligently on this and presenting at many conferences in the Asia-Pacific Rim over the past couple of years. So there are draft requirements. Based on those draft requirements, there's a set of serialization requirements, there's a set of authentication requirements, and there's a set of traceability or compliance reporting requirements. Again, they do classify different types of medicines. They expect that these regulations will phase in over time. They have an end goal, sort of a mental model of saying we'd like all this done by 2023. They've not put that or codified that into hard law at this point in time. They have talked about potentially phasing things in. At the end of 2018, they were talking about a 2020 potential deadline. I think that's probably unlikely, given that they've not really finalized a number of things. There are no hard technical guidelines, for example. But I do expect somewhere in the late 2020 to 2021 timeframe that certain classes of medicines will have to be coded and reported initially to get to that. We're going to protect all medicines in the supply chain for Malaysia by the end of 2023.